Okay, I think we are all on. Let's get started with our adult panel. So my name is Stacy Bigby, and I am mom to Sally, and I have the privilege of facilitating this panel today. I also help facilitate the adult virtual hangouts that we do over Zoom on a monthly or bi-monthly basis. My role is really just to help the conversation to flow. So really the highlight, the expertise is from our panelists. So I'm going to turn this over to Kristin to introduce herself and the rest of our panel.
Thanks, Stacy. As Stacy said, my name is Kristin, and I'm a 39-year-old with Kabuki syndrome from Maryland, and I will be also helping to moderate the panel today. One of the roles that I play as part of Kabuki Syndrome Foundation is I am an ambassador for research. This means because I have done various research projects with Dr. Jacqueline Harris at Kennedy Krieger Institute, and I have even presented at past conferences on my experiences. I help families find research projects they are eligible for, and I also help them locate resources on KSF's website. Additionally, I co-run a sport group for adults with Kabuki, and Stacy has already given you some information on that. Sometimes we have topics prepared, but other times we simply discuss what we have been going through. There is a form for the adult Kabuki group if anyone is interested in joining and is not already a member. So if you could put it in the chat, that would be awesome. And now I'd like to introduce you to our adult panelists. Adults, when I call out your name, introduce yourself by saying your name, age, where you're from, and a unique fact about you. Let's start with Diane. Diane, you're muted.
Yeah.
There you go.
Sorry.
That's okay.
Hi, I'm Diane. I'm 39 years old. I live in Virginia, and I love singing. I'm part of a virtual karaoke group that we perform on Saturday nights, so that's fun.
Andre, would you like to go next? You're muted. Turn on your mic. Turn off your mic.
Hey, I'm Andre Alcock. I'm from Baton Rouge, Louisiana. I'm 33, and a fun fact about me is I love to travel all around.
That's fun. Kaylee, do you want to go next?
My name is Kaylee. I'm 36. I live in Maine. So my closest it would be Boston to get the help I need and stuff. Fun fact about me, when I'm not recovering from surgery, I like to volunteer at the local hospital. It's a lot of fun.
Sally, would you like to go next?
Okay, my name is Sally, and I live in Seattle, and I am 33.
No, how old are you?
33.
23.
23. And a fun fact about me is I love playing baseball on my Little League baseball team.
Cool. Matthew, would you like to go next?
Sure. Hi, my name is Matthew. I am 24 years old. I live in Austin, Texas, and a fun fact about me is I work at a local grocery store called HEB, and I work as a cross-functional team member there, which means I kind of just go around and do a little bit of everything and help out all the different departments.
That's awesome. Okay, I'm going to ask you all a couple of questions around the topics of anxiety and mental health. If there's something you are not comfortable speaking on or has not happened to you, please remember that no one has to talk about anything they are not comfortable with. can you tell us about a time when you felt anxious about something?
So what we want to do here also is if you just want to, if you feel like you want to answer the question, you can just put your hand up, and then similar to our virtual hangout, I'll just help move the conversation around. That way you don't have to worry about trying to raise your hand on the screen or anything like that. So does anyone want to participate in this question about a time that you felt anxious about something? All right, Diane, I see your hand up.
A year ago, almost actually, yeah, over a year ago, I was going through some issues, and it turned out I had uterine cancer, and I had to have a hysterectomy, and I was quite scared and quite nervous. I mean, thank God it didn't go anywhere else, and they were just, able to take out my uterus, and there hasn't been any more issues with that. So that's been.
I'm curious, Diane, in terms of like the feelings around all of the, how did you handle that, the anxiety that came? Was it different? Your normal everyday anxiety? How did you handle
It
that?
was a lot more anxious, just because of this was something new. I'd never experienced cancer before. I have a therapist who I talk to every 2 weeks, who was amazing and helpful. My friends and family were there, basically surrounding me, and kept reassuring me that everything was going to be all right.
Thank you so much for sharing that, Diane. I know that's really personal, sensitive information. Thank you. Kaylee, you had your hand up also.
Something anxious for me was basically the entire year 24. I have had 2 pretty major surgeries, hip surgery that I did not know I needed, and a kneecap that was not in place, and it wouldn't stay in place. So it turned from surgery knee to surgeries of the hip and knee. Little did we know my hip was not lined up correctly with my left leg. So it's just anxious, like, just what's going to happen now? How is this going? How am I going to recover? Is this going to help me? Like, and then I'm doing well now, but like the week before my knee surgery, you're already like everything was set. It was when we had the IV fluid shortage. And they're like, Kaylee, we don't know if we can do your surgery next Monday or not. I'm like, hello, you're not supposed to do this to me right now. Thankfully, they were able to do the surgery, but they told me 3 days beforehand that the surgery was able to continue. So it was stressful. It was difficult to deal with the fact that something completely unexpected, something that's completely out of your control. And I understood there's nothing that we can do about it, but man, it was rough.
Yeah, we're going to explore that idea a little bit more as we go through this conversation. Matthew, you have your hand up.
Yes, ma'am. I have felt anxious at work a few times. Specifically, one of my first days at work, it was like a very busy day, and I didn't really know what I was doing. So all these thoughts were like running through my head because I was afraid that I might do something wrong or someone might get mad at me or something like that. Yeah, I've had some very anxious days like that at work.
Yeah.
Does anyone else want to answer that question, or else I can move on to the next question? Andre, yes. Muted. No, now you're muted again.
Okay. Okay. I kind of like Matthew, or a little bit like Matthew's answer, I was diagnosed officially with Kabuki syndrome in August of this year. And so when kind of looking back, like the struggles and things that I went through at work, realizing now that it wasn't always in my control, or I don't know if that makes sense. My anxiety levels or whatever weren't always, I guess, my own fault.
Yeah, that makes sense.
Yeah, Andre, I'm curious, because your diagnosis is so new,
Mhm.
was that a little bit of a relief to some of this stuff, or has it created more anxiety? If you're open to sharing.
No, yes, ma'am, I am. It was a little bit of a relief for me. I when I was younger, or yeah, when I was 8, I think was the last time I had gone to the doctors, and they were 95% sure at the time that it was Kabuki syndrome, but that was back in 2000 when there wasn't much research and stuff about it. And so my family kind of just raised me as best they could as I don't know, a normal child, if
Yeah.
that makes sense. Or like my sister, I have an older sister. But I think it kind of just made everything line up more, I guess. Different experiences I had in school, or different struggles that might have come about. Yes, ma'am.
Mhm.
Thank you for sharing.
Yeah.
All right. You wanna go
Another
to-
Oh,
Oh,
sorry.
you wanted to add something to that?
Yeah, getting a diagnosis, it kind of helps connect the dots.
Sure.
Like, I had seizures and no one knew why. I had a bunch of these health problems and no one knew why. 36 years ago, they didn't know what Kabuki syndrome was. They thought everybody with Kabuki syndrome had to have these side effects. But
Mhm.
little have they known throughout the years that we can have different side effects. We're like on the autism spectrum. Like no two people are exactly ever the same. But yeah, getting a diagnosis can kind of be a blessing. You get to know what type of help you may need. But then, yeah, it's interesting finally getting answers like, okay, like my hip problem, no one knew.
Mhm.
I always had right knee problems and no one knew why, but we think it's because I was overcompensating on my right. I was putting too much pressure on my right because my left was not lined up correctly.
Yeah. And it's through the diagnosis that then you were able to connect some of those dots to then, wait, we need to explore some other things. And that's when you realize that, yeah.
That's when we found out that there was a genetic doctor in Boston, and
Mhm.
it's
All right, Kristin, next question.
Do you all struggle when plans have to change, and do you have any tips to make this easier?
So what happens when plans change, when things don't go exactly the way you had thought they were going to or anticipate they're going to?
Mhm.
Matthew.
Yeah, so this kind of happens a lot with me at work. because since I'm helping out like all the different departments and we have like a schedule that we're supposed to follow every day, and then they're allowed to just like call us off to all these different departments to help them out. So like I think I've pretty much, at first I was a little bit nervous about it because like we're supposed to be doing this and I'm trying to help everyone out, but we're having to be called here. But nowadays I think I'm more like adapted to it, and because I've been doing it for so long. So now I think at work I've learned coping mechanisms to kind of deal with that.
Do you have an example of one of those coping mechanisms, or is it just the repeated exposure to it, or is there something that you specifically do that helps you?
Sometimes I do have to take like a couple deep breaths, like, okay, like they know what's going on. This is the plan. This is what's supposed to happen. So I kind of just follow the plan, and it is kind of also the repeated exposure to it. Yes.
Kaylee, you had your hand up.
Yeah. As I was saying earlier when I was talking about my surgeries, that was a loop. Finding out that my surgery might not happen, even though it was planned for like 6 months. But I just talked to myself and I talked to my family. It's okay. It's going to happen. We found the right doctor who can do the surgery for you. There's nothing that we can do about the IV fluid shortage. But those few days when we didn't know if it was going to happen or not, I was stressed. But talking about it helps. Holding something inside will just get you more angry and upset and everything else. So.
Great. Diane?
I think it also depends on the situation. Because there are times that I have plans that I'm gonna go out with some friends with their kids, and then I'll get sick. Because with Kabuki syndrome, I also have CVID. And so I can never predict how my body is going to feel. I never can predict how I'm going to feel after a treatment. And so that is very, very hard. There are times that I have to take a couple of steps back and realize, okay, things are not going like I want them to right now, but everything will work out. Everything will be okay.
Yeah, and how do you, because I'm guessing every single one of you on this panel has missed a celebration or an activity or something because you got sick and then had to stay home from that. So how do you deal with that? Do you have any tips or tricks with that, or is it just suck it up and deal with it?
There are times I have to suck it up and deal with it. There are times that I also have to remind myself, you're doing a lot, don't overdo it, because that's just gonna get you even sicker and get you even more exhausted than you already are.
Yeah, yeah. Like it or not, we have to listen to our bodies, right?
Yes, absolutely.
Yeah, Kristin, you want to add something to that?
Me?
Yeah.
Yeah, like over the summer I was having just different health issues, and we were supposed to go to a museum like the next day, but my health issues were not going well. So we decided that we should stay home and try to get in contact with the doctor and see what they wanted us to do. And part of the reason that we were going to the museum is because we had some family friends staying with us for like overnight, and then the next day we were all gonna go down to the museum. And their son is about 1.5 years older than me. And we decided when I couldn't go, we just decided that we would all just stay home, and we just like kind of like talked and we played games and stuff. So like for me, it really showed me the support that I have in my corner, even though I did not want to miss it. So I was really glad that that happened.
Andre, you want to add to that?
Yes, ma'am. I kind of had a similar event. My family all lives within 5 minutes of each other. And so I'm very involved in my sister's life and in my niece's life. And there was an event that one of my nieces was singing at, and I wasn't able to make it a few weeks ago, but kind of had to keep reminding myself she's only 8. You see her all the time. You do stuff with them all the time. Like, you don't, I don't know, trying to give myself grace of you don't have to feel guilty for not feeling healthy enough to show up or to go.
Yeah. Yep. All right, Kristin, next question.
Yeah, I can ask another question. So do you struggle with waiting and anticipating things? And do you have any tricks that make it easier?
You struggle with waiting and anticipating. Oh, Kaylee's out.
Daily, yeah.
Yeah, not always thinking about it. Clear your mind a little bit. Go do something that you enjoy. When I was waiting to see if my surgery was going to happen, it was not just talking about it with my family, but it was also, I enjoy adult coloring. It was doing my diamond arts that I enjoy. So it was thinking about other things, not just dwelling, is this going to happen? Think about other things, not just what's bugging you or what's going to happen.
And it could be a positive thing too, right? Like it
Yeah.
could be a trip you're going on or something you're excited
Yeah.
to happen as well, right? It doesn't
Yep.
have to just be a hard
Yep.
thing. Diane?
You could be at the airport waiting to go to Florida and your flight gets delayed. I mean, there are some things you just can't control.
Yeah.
Yeah.
A little bit like what Kaylee just said, when you have something that you're nervous about waiting for results to stuff like that, get your mind on something else. Do a puzzle, go out with a friend, go do something else to kind of take that off your mind so you're not dwelling on it, so you're not thinking about it 24/7.
Yeah. I want to shift the question just a smidge. So you're all adults now, but there was a time when you were a child and now we can say to you, take a deep breath, go do something else, do a puzzle, go, think about something else, talk about something else. We have a lot of people on right now who have small children. So think back to when you were a child. What is some advice we could give to those families for when their kids are struggling with some anxiety, or when plans change, or when they're waiting for something and asking a million times?
What's it gonna happen?
Yeah.
Just listen to them. Listen to their concerns. Make sure that they know that you're there for them.
Yeah. Kelly, did you want to answer that one? What's some advice you could give to parents of younger children?
Okay, so when you are dealing with small children in a hospital aspect, you need to distract them as much as possible.
Do something fun so that they don't just think of the negative.
Which is so very hard sometimes even for adults, because it's like, why is this happening? This should be happening.
Yeah, Matthew, you have your hand up.
Yeah, kind of going off of what Stacy said, when I was a kid, I really enjoyed coloring or singing. So like maybe like putting on a song that they really enjoy, or like maybe coloring with them. That would be those were a couple things that I really enjoyed when I was a kid. I also enjoyed like playing with toys. So maybe like bringing along some of their favorite toys or whatever. I think that would help out a lot.
I definitely agree with that.
Yeah, when you know that something might be happening, like say a surgery or something like that, plan something fun beforehand if you can. So that they're just not thinking of the negative, they're thinking of the positive also.
Diane, yes. I meant to look here in it.
Also plan on doing fun stuff with them after. Like if
If
you
you
know
can.
that there's a surgery going on and they're not going to be able to get out to go do stuff. So get them prepared to be able to kind of stay home
Mhm.
for you guys to be able to do together, whether it's baking, whether it's coloring, doing puzzles, their favorite movie.
Give them,
You know.
and also having that goal for, okay, when this is over,
Yes.
right? That can be a big or a little thing, right?
Yes.
But that like, okay, let's think about what's happening after. That's a great idea. Yeah.
Yeah.
Yeah. Oh, Kristin, you're muted.
There we go. Yeah, I was gonna say I like the idea. I think we have time for one, maybe two more questions.
Okay.
One of the ones that I really want to ask is, have you found any treatments or medications to help with your anxiety? Diane.
I am on Lexapro right now for my anxiety, and I see a therapist every 2 weeks.
Anybody else want to answer that question as well? Matthew?
Yes, I am on Adderall right now for my ADHD. I am on, I believe, 50 milligrams right now. Oh no, 5 milligrams. 5 milligrams. Yes, ma'am. Yes.
I'm curious, Matthew, when did you start taking that medication?
Adderall, I started taking it not that long ago. I think it's only been like a few months ago that I started taking it, back in like June or July.
Okay. And Diane, what about you? When did you start taking medication for anxiety?
Well, my anxiety medication, I've been on a couple different. I started on sertraline Zoloft, and it worked for a little bit, and then we realized it wasn't doing what it was supposed to. So we ended up doing Lexapro, and I've been seeing my therapist for about 6 years. And I also take Vyvanse for my ADD, which is a help.
Okay. Does anyone else want to jump in on this question? Otherwise, we're going to start moving to some of the Q&A. Kristin?
Yeah, so I am on a medication to help with my anxiety, but it also helps with my migraine called amitriptyline, and I'm on 50 milligrams in the morning, 75 in the evening.
And how long have you been taking that?
I started just at only 50 milligrams in June of last year, so June of 2023. And then I moved up to 75 in the evening in June or July of this year because I needed a little bit more, but not too much more.
Okay. First, before we go to Q&A, I just want to say thank you to all of you for being so open to sharing and providing us with your personal experience and just sort of this shared experience. As a parent, it's very helpful to get perspective. So we have some of our participants who have asked some questions. So our first question, thank you all for sharing. My son is almost 18. He was diagnosed when he was 14. I'm curious, how was the transition from your pediatric care to adult care teams? We love our pediatric team and we're sad to transition. So how has it been moving doctors? Kaylee?
Get recommendations of who the next doctor should be.
Mhm.
Maybe they work with the pediatric or something. Maybe the pediatric doctor will know somebody like, oh, this person's really good. Have some information about Kabuki syndrome maybe ready for the new doctor so that they understand kind of what they're dealing with. And just information for them to pass on. But if they're part of the same hospital, then it's probably already there. But yeah, just maybe do your own research, ask others about who they like for an adult doctor.
Okay, that's great. That's great. Kristin?
For me, when it was time to start moving to a new doctor, my pediatrician kept me on longer than he should have. But we talked to my then geneticist and asked him, who would you recommend for for a primary care doctor? And he had someone in this practice that had been phenomenal. And then also, like, slowly we asked other doctors, because I'm mostly seen at Hopkins, so we would ask doctors who I have now who they would recommend for different issues. And then, so that's been a huge part of it, because it's like, once you have one doctor in like a specific area, ask them like, who would you recommend for this or that? And that was huge.
As a parent, I would say the other piece for us has been this network. We've been able to, we know other families who are older than Sally and also some who are younger. So we can reach out to those who are older and ask, who do you see for this? Or what's been your experience in that? Which has been really great. And then we're able to sort of provide that same feedback and input for those who are younger. So this network is really, really helpful in that. All right, next one. Oh, this is a shout out. Shout out to Matthew. My son was born in April of this year with different health issues. While being in the hospital, by coincidence, I saw the episode of The Good Doctor with Matthew, and it was the first time I heard about Kabuki syndrome. That gave me the hint to speak to doctors and speed up the diagnosis for my son. And shout out to Matthew, but also that's one of the main reasons why something like that is so important, right? You want to speak to that a little bit, Matthew?
Yes, thank you very much. That was a very nice shout out. I'm glad that that episode was able to spread that awareness and kind of, spread awareness of Kabuki syndrome, because I know that right now it's a pretty rare genetic disorder. And as we were talking about earlier, not a lot of doctors really know about it. So it was nice to be able to spread that awareness through that episode.
Yeah, I actually have used that episode. I met somebody through a totally different situation. And when the first time I saw her, I was like, she's got to have Kabuki syndrome. And so I started asking her some questions, and she had never heard of Kabuki syndrome. And so I said, hey, because you don't want to just like jump down, like pounce on someone. And so I suggested her watching that episode as just a soft entry into, I don't know, check this out, maybe. So yeah, I'm so grateful that that episode was out there and that Matthew, you stepped up to play that role.
Yes, it was an amazing experience. Thank you, guys.
I bet. All right. Oh, this is a good one. This is a question we get. There's been a lot of conversation about this over the years. So I'm curious to get your feedback on this. My child will ask the same question over and over again, even though they already know the answer. I'm assuming she's anxious. Did any of you do this? And if so, how can I help her move past the question? Diane?
I do this. My mom does get annoyed with me if I ask something. And sometimes it's because I forget that I've asked it and I'm just asking it, just to ask. And other times it's because I am anxious and I, don't know how to bring myself down. Like after, the anxiety is so up there, it's hard to come back down.
Do you feel like you did this more as a younger person, or is it something that's still pretty prevalent for you now?
It's something that's kind of still prevalent to me now. It depends on the circumstances. Depends on what it is. If it's a doctor appointment or if it's, getting test results, whatever. Getting anxious is just something that happens, and it's trying to live through it and not let the anxiety control my life.
Yeah, Matthew.
Yeah, I think there's a couple big things with this. Number one, it could be like sometimes I ask a question and then like someone gives me an answer that I don't quite understand it. So I ask it again, and then they explain it to me the same way, and they get a little bit madder each time. And I'm like, I don't understand what you're saying. And another thing would be they could be just trying to start a conversation, they probably don't know how to start a conversation. They're trying to think of a way to start a conversation, so they're just asking the question to get the conversation started, if that makes sense.
Yeah. Hey, Andre, you can leave your little puppy in the screen. Kaylee, you wanted to ask.
Sorry, he's a mess.
You do not need to apologize. He's a kitty.
He's a mess.
Kaylee, you wanted to add?
Yeah, maybe if there's a common question that's asked, like, have the answer written so that they can look for the answer without having to ask 20 different times or something. Like if they're worried about library every week at school or something, mark on the calendar that Wednesday is library day, so that the child will know, oh, that day with the star means it's library day.
And so if they are, as a parent, I've already answered when you say, when is library? How many days to library? Yeah. I can just say,
what is it?
If they have the capacity to do that,
Yeah.
Go to the calendar, look over at the calendar. So just move them away from the conversation and into an answer. Is that what you're suggesting?
Or they can look back at the answer and not forget. And so that they can be prepared Tuesday night. Oh yeah, I should go find my library book and put it in my bag so it's ready for tomorrow.
So I guess on top of that, so Matthew gave a couple of ideas of why somebody might be asking a question over and over. Mm-hmm. And I'm wondering, is the asking of the question, are they actually trying to get to the answer? Because they already know the answer. If it's like, when is library or whatever, they already kind of know the answer. So as parents, we get the question and we answer it. But is that really what are they trying to get to the answer, or is there more behind that?
It kind of all depends on what the question is. What are they wondering? Like, are they anxious? Are they nervous about something? Or are they trying to talk to you? Like, it's hard. It's a difficult one.
Yeah.
They might be trying to express their feelings.
So by asking the question, they may be trying to express more of that they are anxious about.
I'm confused. What does this mean?
Okay. Andre, you want to add to that? And then
Kind
Chris.
To go off of what Matthew had said, sometimes if I repeat the question over and over, it's simply I didn't understand the answer, or the answer you gave didn't make sense to me. And so I know with like my parents, it's one of those things they've had to just, like, I guess, practice patience and realize that me asking it over and over, it's not trying to be annoying, it's not trying to irritate you, it's just trying to make it make sense for me, at least.
Okay. Okay. Kristin, you want to add to that?
Yeah, I was gonna say it can sometimes also lead to anxiety, or like if they're constantly thinking about it, it could also mean that they're anxious about something and they just need to talk it out with someone who will listen and just not judge, if that makes sense. Because I know for me, like earlier in the summer, it was earlier in the fall. I was really nervous about this other doctor appointment, and I was talking about a lot with my parents, and they're like, we already answered that question. Like, what's with constantly asking the same question? And then I was with a doctor of mine when we co-hosted an event, and I'm like, can I just talk to you for a minute? Like at the end. So we went off and we talked by ourselves, and then she managed to calm my anxiety and help me to realize, because I think part of it was also I was nervous about the unknown. And it's like there really is no unknown. And she helped me to see that whichever way the direction went, it would be fine.
Okay, great. All right, next question. For those of you who are taking medications, do you have side effects? Do you have any side effects from the medication that address attention and or anxiety? If so, what are they and how do you manage them? Diane?
Some of my side effects sometimes is drowsiness. I'm tired. It depends, on what's going on. So sometimes and with my ADD medicine, it makes it so I'm focused. Like there are times that I can do 5 loads of laundry, like fold and distribute and put away, and that's all because of I take that medicine. But if I don't take it, sometimes I can get to only like 1 or 2 loads. So not as many as I would be able to get to if I go ahead and take that medicine.
And do you have side effects? So that's the reason you're taking it, but then are there other side effects as a result of that medicine that you have to manage also?
Yeah, because then I can't rest. So if I have a treatment and stuff like that, usually I'll take the short lasting one when I go bowling, and then I'll come home and sometimes have a treatment. So I don't take the long lasting, but I'll take the short lasting to make it just a couple of hours.
Okay, good feedback. All right, we're getting near the end, but we have another really good question. This is a good one. What things were triggering for anxiety specifically at school? And what modifications were made by you or staff to help ease them? Kaylee.
Homework was always very difficult. Me and Math didn't always like each other. So it was my parents realizing when I was younger that I needed to be in the resource room. So I'd be taken out of the big class and put into the smaller room. And even then, it wasn't that much smaller, and it was only one teacher. So they realized after a few years that I needed more help. So they moved me to a special ed classroom where it was like 10 or 12 kids, but 2 teachers. So the teaching, sometimes you just got to stick up for yourself. You got to talk with your parents. They got to stick up for you. And, but yeah, the being put into the special ed, was one of the best things that my parents could have done. It wasn't an easy choice, but they knew that there was a struggle and they knew it wasn't good for me. So
Yeah, we could we identify with a lot of that
Mm-hmm.
same thing. Sally, did you want to add to that?
Okay, normally like people screaming, with like the kids in the wheelchairs, they like scream a whole lot.
So there were kids in your classroom that were screamers,
Mm-hmm.
and how did you work around that? Caused you some anxiety?
Yeah.
And so how were you supported through that, or what did you do to handle that?
They were just around us a whole lot more, like the teachers and stuff like that, to like get us back on track and to like help us through it.
Okay, so you were able to communicate to your teachers that caused you anxiety, and then they supported you more to help you. Okay. All right. Anyone else want to answer that question? Really quickly, and then we have just a quick wrap up. Diane?
I was in special ed for as long as I could remember. Second grade on. I had really, really bad test taking skills. And then I would go ahead and the SOLs were just, I did not like them. I did not do very well with them. And so there were times that I would have to have someone do it with me. And then like there were certain SOLs that a teacher would take me out of the room and take me into a smaller room. And I barely passed to be able to get the modified diploma.
Yeah, so it sounds like really it's the extra support. That's the commonality through all of your answers was extra support. Okay, so
Yes.
we are going to wrap up this adult panel. One of my favorite questions to ask of adults in this situation, especially for those families who are new to this journey, have young kids, are feeling overwhelmed, and might feel like that, like this is maybe they don't see a light at the end of the tunnel. What encouraging word or advice, really quick, like 1 or 2 sentences, can you give to those families with little kids new to this journey? I'm going to have all of you unmute and I'm just going to roll through us really quick. Kaylee.
Okay.
it's all going to be okay. Be
all
there
gonna
for the
be-
kid. Be open with the teachers and get the right kind of therapy that you might think that they need. If it's speech therapy, physical therapy, any type of therapy there is. Like,
Awesome.
and if the kid is struggling, explain that the therapy is there to help you. They're there
Thank
to.
you, Kaylee. Thank you. Matthew.
Just never give up. I know there's going to be a lot of struggles through the journey, and there's going to be a lot of times where you feel like you might want to give up and like, oh, this isn't working. I'm just going to pull them out of this. No, you got to push through, and you got to. They'll learn to adapt eventually.
Thank you, Matthew. Andre.
Would kind of go off of that and just say, hang on. That doctors and everyone are still trying to find out more and more about Kabuki syndrome, and they might not have all the answers right now, but that doesn't mean they're not coming, or don't give up, I guess.
Don't give up. Love it. Diane, real
Just
quick.
keep climbing.
Yeah.
Keep climbing. You'll get there.
Love it. Kristin.
Mine would be to advocate for the kids and also to not only advocate for them, but try and teach them how to advocate for themselves after they get a little bit older.
Maybe see a genetic doctor. Have a genetic doctor
Yep.
Callie, you have anything? Any encouraging word? No, they all said it?
Yep.
All right. Thank you all so much for being open and sharing with us. We so appreciate you.